voice. And so if I stop to drink water or cough, my apologies in advance. So my name's Crystal. I am a research scientist at Temple University. I'm a behavioral psychologist, and yeah, I've worked with individuals with disabilities for probably over 20 years now. And yeah, so I'm glad we get to share some of this information because I'll talk a little bit more about this, but this stemmed from a project we did a couple of years ago in rural areas. And so it's is an interesting topic to me. I grew up in a very rural area in Canada. I think the town had like 1,500 people, like corner store, no grocery store, small. So although I live in a city in Philadelphia now, I am extremely familiar with rural areas. And so I really enjoyed doing this project. And then I'm gonna pass this off to Rebecca so she can introduce herself.
Hi, I'm Rebecca Roberts, and I'm the Director of Training and Technical Assistance for April. April is the Associated Programs for Rural Independent Living, and we're a membership organization for Centers for Independent Living. I also have personal experience with mental health concerns and live in a very rural state, and we'll have some examples from that moving on. Thank you all for joining. It's really nice to meet you all.
Yes, it's great to have everyone here. Um, yeah, it's exciting how many people signed up. Hannah, I think you're still letting people in. Do you want me to hold off for a couple minutes or?
It's up to you, whatever you prefer.
I'll give it another
Just
minute
trickle
and
in.
then, okay, I'll get started. The first couple of slides aren't that exciting anyway. So this is a presentation today on community inclusion and participation, people with mental health conditions in rural areas. Um, yeah, so we did this project, like I was saying, and we're excited to share some of our findings. And we're happy to have Rebecca here to give some of her insights with her experience with our partners on this project, April. So the first thing I want to do is acknowledge our sponsor. So our ability to do this work comes from grant funding through the National Institute on Disability, Independent Living, and Research, Rehabilitation Research. And so this project was part of a larger funded grant. And in that grant, we have funds where we do research projects, and then we also have funds where we do what's called knowledge translation, where we do things like webinars and provide support to people, agencies, government agencies, state agencies, providers, policymakers who work with people with mental health conditions. Yeah, and they sponsor our work to do that. So we're able to provide these trainings and support free of charge. So I'm just going to go over what we're going to talk about today. So just in case people are less familiar with this topic, I'm going to give a little bit of background on community inclusion and participation. I'm going to give an overview of the project we did in the rural areas a couple of years ago. And then I'm going to go over activities that we found people said were of importance to them when we did that project, barriers that were identified, and then the solutions that people came up with to overcome some of those barriers. So I wanted to start off first by saying, what is community inclusion? So when we think of this, you might first think of exclusion. So if we look at this picture, you can see um, the blue, dark and light blue would be people, the general population. Gray is people with disabilities. And you can see exclusion would be where they are not involved in any aspect of the same activities as the general population. Segregation is this idea where they're specialized activities or specific housing or projects, but it's only for people with disabilities. So they're working, but in an environment where the only people who work there are people with disabilities, or they're going to some sort of day program, but the only people are there are people with disabilities. So there's social activity involved, but it's not inclusion because they're still only with other people with disabilities. Then we have integration, where it gets a little bit closer, where you might have a group of people with disabilities who are now all doing an activity, in the same area as a person, as people from the general population, but they're still separated. So it'd be the idea of, we're going to go to a baseball game, but all of the people with disabilities are going to go there together, sit together, and only interact with each other and not anyone else at the baseball game. Or they might go to university, or say they're in a classroom. I think of like elementary schools, like all of the kids with disabilities might go to the same school as the general population kids, but they're in a different classroom. So they're at the same school, but they're in a different classroom. And so it's this idea that they're in the same space, but it's still not inclusion. So what we're really looking for is complete inclusion, where people are involved and interacting with the general population, where people are able to live in the community and be valued for their unique abilities just like everyone else. So they're going to work in the same places as everyone else. They're getting to do the same activities as everyone else, and be fully included. So this involves being valued for your own uniqueness, opportunities to participate like everyone else, and then in finding environments that are welcoming and embracing, where there's accommodations provided, where people feel accepted and not stigmatized or discriminated against, where it's really a safe space. So what is community participation? So I have some pictures up here, some examples, but really it's everything everyone does on a daily basis. Employment's probably the biggest one, where we spend a lot of our time. Going to school, housing, dating and marriage, parenting, leisure and rec, spirituality, religion, joining faith communities, civic engagement, voting, protesting, being involved in your community, to have community gardens, family relationships, friendships, and social relationships. So this is just a small list. There is a ton of other things that qualify. It's basically anything you could think of that is a meaningful activity to somebody. So why do we care about this? Why is it important, right? So, well, it's important because, one, it's a legal and human rights issue. So, nations must promote full and effective participation and inclusion in society, including competitive employment and participation in the economic, political, social, cultural, recreational activities of their community. So this came from the UN. This is a Convention on the Rights of Persons with Disabilities from 2006. So this is a legal right. And then all of these other acts also support this same idea. So the Americans with Disabilities Act, the Supreme Court Olmstead decision. So this is against unnecessary institutionalization. It's considered a form of discrimination. The President's New Freedom Initiative and the President's New Freedom Commission report. So there are lots of legislation and policies related to this as it being a human rights issue. We in our center, because we're in a college of public health, and people always think it's a bit weird. They're like, oh, but you do mental health work. Why aren't you in a psych department? Why are you in a college of public health? Because for us, participating in the community is a medical necessity. Just as important as treatment and any other aspect of what people with disabilities need in their life. So for people with mental illnesses, it's a medical necessity because they often have premature mortality. So people with mental illnesses often die 15 to 20 years before people in the general population. And getting out and about and doing activities that are meaningful have basically shown doing those things has been associated with better physical, mental, and cognitive health. So it's a medical necessity. We always say, in order to feel better, you got to go out and do things. So we don't want people to wait to feel better to do stuff. We want people to do stuff because that's what's going to make them feel better. So on our website, on the right here, there's this document called Well Together. So if you go to the Temple website, and I can give everyone the link in the comments before we leave, there's this document that basically is a blueprint for community inclusion in case anyone's interested. So mental health, this was another study that someone in our center did, and we looked at percentage of time at home versus percentage of time spent alone. And so you can see within the US general population, people spend 54% of their time at home and 41% of their time alone. People with serious mental illnesses, it goes up to 80% of time spent home alone. That means most of their time is spent home and 55 to 75% is time spent alone. So they're spending the majority of their time at home and alone. I also just want to make a note because I said earlier, I was saying mental health conditions, and here it says serious mental illnesses. And I just want to make a note that I know serious mental illness is not the preferred language, and we understand that words have power. The reason why we often use serious mental illness terminology is because it's what the funder uses and what is often used in the research literature. And so if you see that serious mental illness instead of mental health condition, that's the reason why. So we understand it's not ideal. But I just wanted to give that preface of why it's there.
If I
So,
could, oh, go ahead.
no, do you want to pipe in, Rebecca?
I just wanted to talk about how important with mental health it is for people with serious mental health conditions to get out in their community and not be socially isolated, because it not only improves, mental health in the way that we always think of things like exercise and socializing help reduce stress, but according to the American Psychological Association, it specifically physical and social activity reduces anxiety, depression, stress, and for some other serious mental illnesses, it reduces unrealistic thinking. Because if you're by yourself all of the time and you have a mental illness that influences your thoughts, you don't have anything comparing that to, right? You don't
Yep.
have a group in which we all judge our thoughts, kind of based on the feedback that we get. And if you're not getting feedback, that can be very detrimental to someone with a serious mental illness. And I know we read a lot about that impact on physical health, but there's some real specific issues with particular mental illnesses that are related.
That's a really good point. I like that idea of the feedback issue where people can it's hard to get positive feedback from people if you don't see anyone, and it's an important aspect. I always say, as being a psychologist, where people have this idea that confidence or self-esteem comes from within, and it really doesn't. It comes from within once you've had an outside word telling you that you are worth something and you matter. And that's another aspect of it too, is one of our colleagues, Brian McCormick, actually studies this concept of mattering, where when you don't show up, people are going to notice. And that idea of mattering, where people are going to notice that you're not there, really is another key aspect of participation. So we know participating is associated with more physical activity, which is obviously going to, getting out and about, you do more physical activity is going to have effects on weight and diet and just your overall cardiovascular health and all of that. Hit the slide. People are happier and they have less loneliness when they get out of the house. There's lower levels of depression, reduced positive symptoms in schizophrenia. And then it's also associated with recovery on recovery scales and perceived quality of life. So people will report feeling more satisfied about the quality of their life when they've been out and participating more. And I just want to make one note about it. When we talk about participation, one key part of it is it's not participation in what I think you should be doing. It's participating in activities that are meaningful to you. And so it's what is meaningful to that person. And so one of the things we measure often is importance. And so we don't just want to know how frequently somebody is doing activity X. We want to know how frequently somebody is doing activity X that's important to them, if that's the thing that's important, and if it's enough, if they feel like they're doing it as much as they would like to. And so we talk about it in that aspect as well. So it's also good for cognitive health. So we know that physical activity also influences brain functioning. So planning, scheduling, working memory, social interaction prevents cognitive decline. So social isolation will reduce cognitive decline. Unemployment. So when people are employed, they're often in poverty, and poverty can impede cognitive functioning. And I'm guessing this has to do with stress. So we forget that when people are poor and you're constantly having to think about how you're going to pay your rent or buy groceries or pay for basic needs, it's so stressful, it's hard to plan or think about anything else, and that can affect cognitive functioning. It just drains cognitive resources. The other thing too is it's actually also stimulation. So when you get outside and there's birds singing and there's trees or buildings, or if you're in a rural area, parks, or seeing other people or just hearing noises is all stimulation that we need for our cognitive, maintaining our cognitive health. So now I'm going to talk specifically about participation in rural areas. So I know people are like, why did you do this project in rural areas? You're at Temple, you were in Philadelphia, it's a big urban place. And we've done some work, presentations with people who are in rural areas. And we've gotten some comments where people say, I just don't think this is relevant to rural areas because there's just fewer opportunities to do things. So your Temple community participation measure that has 29 areas, it's not relevant because rural areas, there's just there are fewer things to do. And the interests of people in rural areas are different than people in urban areas. So if you're in Philadelphia and you're doing research in cities, your findings aren't going to generalize or be the same as people in rural areas. So it's not as important or it's not as relevant. And then there's this idea that there's nothing you can do. So in rural areas, if the opportunities aren't there and the activity variety is not there and there's harder to get a job and all of these things, and there's too many barriers and the barriers are different and huge, there's nothing we can do, so we're just not going to work on it. So we wanted to do this project to kind of get at these beliefs, which might be sort of myths about participation in rural areas. So that's kind of where this sort of started from. So this is what we did. We conducted a series of conversations, like focus groups, in 2 different counties in rural PA. So Mark Salzer, who's not here today, and I drove in the car, had a little adventure, and we went to counties that were closer to Philadelphia, and then another one that was far off, closer to Pittsburgh. So we crossed the state pretty much, and we did it twice. So we went once and gathered information, and then we assembled it and analyzed it, and then went back, presented that information, and then did it a second time. So the groups that we had were made up of service providers, individuals with mental illnesses, and their family members that lived and worked in that county, essentially. We asked 3 questions. So we asked people, what activities do people in rural areas like you like to do? In the same meeting, we also asked people what the barriers were that were preventing them from doing those activities. Then what we did is we went back to Temple and we compiled a list of barriers. And then we went back and said, okay, here are the barriers. What are some ways that you think we can reduce these barriers or work on these barriers? And that's the list of solutions we have. One of the other things we did, and you're going to see when we look at the activities and the barriers, they're ranked, they're sort of in order. And because what we did is we had put them all on the wall and in a list, and we gave people, each person got 3 sticky dots, and we had asked people to go up and put each of the dots on the 3 activities or the 3 barriers that were most important to them. So either the 3 activities that were most meaningful to them or the 3 barriers that they found were making it harder for them personally to participate. And so from that, we were able to kind of get a bit of a ranking. So what we found out was people in rural areas, turns out, like doing the same things as everyone else. So these were the ranking of the activities. This is not surprising. Socializing with friends and family and outdoor activities were the 2 highest. My guess is that people who live in rural areas choose to live in rural areas. And maybe they choose to live in rural areas because they really like outdoor activities that are hard to do. It's really hard to go fishing in Philadelphia unless you go for an hour or 2 drive to probably a rural area. So my guess is, doesn't make sense. Live in rural areas because their top preferred activities are outdoors and socializing, which you get the sense of community in a rural area because it's smaller sometimes where everyone knows your name sort of thing. So what we found interesting though is that aquariums and zoos, traveling, going to concerts, sporting events and museums were also rather high. I know that you can go to concerts in rural areas. They'll sometimes have local bands. I know there's sporting events like Little League. The Little League championships are in Williamsport, Pennsylvania, and it's a huge sporting event. But the point of this is that people were also happy to travel to go do these things. Like, people don't need to go to a museum every weekend. They would be happy to drive for 2 hours to Pittsburgh or somewhere else to go to a museum, if they had the way of getting there. So we found it interesting. The other thing that was interesting is that working, volunteering, and attending classes was quite low. So you'll see that employment and poverty and resources came up as a big barrier, but it was interesting because working didn't come up as a preferred activity. And we suspect that in rural areas, it's harder to have a good person job fit because there's just not as many jobs. And so it might be harder for people to find a job in a rural area that really is something they're passionate about and is something that they really enjoy doing or that they are motivated by. And so we only speculated that working might not have been as important because it's seen as a means to an end versus something that um, they enjoy doing in and of itself, just because of not having the options for variety. So no surprise, transportation was a top barrier. Transportation is also one of the biggest barriers in urban centers as well. So I think what's interesting about some of these barriers is that they were the same as what you'd find in an urban area, but aspects of them um, were different. So public transportation might be better in an urban area, depending on where you live, but it might not be affordable. Um, Depending on where you live in an urban area, it might be easier to walk. Biking is actually probably more dangerous because in Philadelphia, if you're biking, for example, it's easier to get hit by a car. So biking would be easier in a rural area, but there might be greater distance between places. So walking might be hard because things are more spread out. Public transportation is not great in rural areas. It's not as frequent. There's not as many routes. One thing we found that was really interesting is that accessibility, so the availability of activities in rural areas was not listed as a top barrier for people. So they didn't care that the museum is in a city farther away. They were happy to go there. The barrier was the transportation to get there. And so we thought that was interesting that they didn't view what was available in their town as being a barrier to participating. It was the transportation piece of being able to. Lack of resources was very high. Um, Even though employment was not ranked as high important activities. But this is also urban areas, it's the same thing. So if it's, we know that people with serious mental illnesses are less likely to be employed. Disability is not very high paying. And so poverty is a real issue and a lack of available resources. Personal factors, symptoms, physical health, lack of confidence, internalized stigma. So having faced discrimination for many years, people start to take it in and believe it and basically put it on themselves. This is what Rebecca was talking about with that feedback loop, probably
Yeah.
a little bit.
Yeah, I'd like to address that a little
Yeah,
bit
yeah.
more too. These things are related in that there's sort of a cycle that happens with mental illness. If you have mental illness and you have face stigma, which is you put internalized stigma, and I think that's really important because the stigma against mental illness is so strong that we do internalize it. And if there are symptoms related to our mental illness that others can see, which there often are, um, there's such a need, you feel like you can't go anywhere unless you can mask. And masking and being in big groups of people are all things that trigger symptoms for people with serious mental illness. So it kind of stacks up on top of each other, right? So the personal factor, such as symptoms and how that's related to the stigma that's there, and even some of these other things like lack of resources. I'm sure that this is probably true in urban areas as well, but when you have a disability and you need to, you may be on disability, but you may be getting all of your medical care or your mental health care through a program like Medicaid. And there's sort of an enforced poverty there because there's an income limit. And so if you only have a low-paying job available to you and you take it, you'll lose your insurance. So the idea is, unless you can get a job that's well enough paying to have insurance, it's not going to be high on your list of priorities because you're going to lose the resources you have in order to go to work, whether you're socially motivated to do that or financially motivated to do that. And we see that a lot in rural areas because there are jobs, but they're not, you know, they are not tend to be jobs that have insurance benefits, not real well-paying jobs. And so you kind of, if you have a disability, including a mental illness, you may really jeopardize your resources by going to work. And so I just feel like these barriers build up on each other and they go deeper than what it sounds like just at the top, like lack of resources. Well, why don't you go get some money? Well, if I try to increase my resources, I lose other resources. And it's just really a circular problem.
It really is. I think that's a really good point. What was interesting, so the next one was prejudice and discrimination. And I didn't put the numbers up here, but what I want to tell everyone is that prejudice and discrimination, half as many people put that as a high barrier than people who put personal factors. And so what this tells us is that people with mental illnesses are blaming themselves more than the outside discrimination as being the barrier. And then there's probably also a little bit of a medical model still going on where it's what's stopping people from participating is their symptoms. So even the providers in the room might have put personal factors as a higher rank than prejudice and discrimination, which again comes back to this idea that people need to feel better or be asymptomatic before they can do more. And we would argue it's the opposite. By doing more, you're going to become less symptomatic and have better physical and mental health and reduce some of that sort of internalized stigma when you have some successful experiences. But prejudice and discrimination is one of the things that does look different in rural areas. So although the lack of anonymity in a rural area can, the old like everyone knows your name can give a sense of community for people. It also, knowing your name means that there's no anonymity. And if you're the person with a disability, and everyone knows, it's really the stigma can be much greater. There's also rural cultural patterns around like stoicism where people don't talk about their feelings or mental health as much, so people might try to hide it. So there's aspects of rural culture that can actually make prejudice and discrimination worse because it might have a little bit more of a pull up your bootstraps, you can get a hold of yourself mentality than you would find in an urban area. And then it's exacerbated by the fact that there's no anonymity. So your doctor, your mental health provider might be your neighbor. And then you might not even get to see a specialist. You're going to see a general practitioner, and that's going to be the same doctor as everyone else. And it's just this, it just gets clustered together. So it's complicated. And then all of the other barriers were substantially lower. So it was lack of information, weather, you forget, in Pennsylvania in the winter, the snow and stuff can prevent people from doing things, or extreme heat in the summer. A lack of formal mental health services. So again, a lot of people in rural areas have to see a general practitioner rather than a mental health specialist. There's a lack of natural supports. And then people said there's just hard to get experience around jobs and other skill development. And then another one that actually did not get mentioned, and I was shocked because we know it's a barrier, is the digital divide. So we know that internet, cell phone service is spottier in rural areas, which can be problematic.
Can I talk just a bit about that lack of formal mental health services?
Yep.
I live in the state of Wyoming. We have whole counties that do not have a mental health practitioner or resource there. And even in our few bigger towns, which most of you might not consider bigger, like 30,000, 40,000, 50,000 people, there's such a lack that people either receive no treatment, or as you said, they often receive it from their general practitioner. General practitioners often lack, any specialty in mental health training. The most common thing they give is the depression screening, so to try to catch depression. And if there are mental health providers, they're generally counselors who are not trained as psychiatrists or psychiatric nurse practitioners are in diagnosis of mental health disorders. So I, who was affiliated with the university, had good, medical insurance. I had a mental illness that strongly affected me with symptoms from the time I was 13 years old, and it wasn't diagnosed until I was 40. Because I was relying on general practitioners for my mental health care. And so I had tried every, antidepressant on the market, but nobody was asking me, do you ever feel like Superman? There were other things going on.
Yeah.
And in some counties, you mentioned the lack of transportation maybe being difficult, you couldn't walk. So if you have an entire county without a mental health practitioner, and you have barriers such as mountains and weather and all of that to get somewhere, this lack of mental health services is, it kills people. It's so serious that I think sometimes those other social things that we think about, all of those things that we've been talking about, can feel pretty secondary to barriers that you're facing.
Yep. Thank you for sharing your personal experience, Rebecca. I think I appreciate it. It adds another nice element, personal touch to this. Yeah, it's a huge thing. And then with the internet, I know there's telehealth, but if internet is not great, it doesn't help. So, but one thing we want to focus on, probably for the rest of this presentation, is that although these things seem insurmountable and hard, people came up with a lot of potential solutions, a lot. So what we wanted, and some of them are harder, some of them are policy and will require advocacy and more long-term goals, but some of them were actually quick and easy things that could be implemented tomorrow. And so we want to go through the ideas that people had. And we realized that not every idea would work in every area, but we just love the idea that they came up with so many potential things. And I think it wanted to share them to remind people that in your area, if you just get together and brainstorm, you probably can come up with some solutions to these problems. That they're not insurmountable. So we want to give people hope that these things are, you can overcome them. They're not permanent barriers. So transportation, expanded public transportation is clearly a policy thing. I'm aware. It's not a matter of just going and knocking on someone's door and being like, hey, can we get a couple more stops? I realize it's related to government funding, but related to it, it wasn't just hours, days, number of stops, routes, and the frequency. There was also about trying to give people tokens or money for rides, because sometimes public transportation is not affordable. Or giving people discounts or lower costs for the bus for people with disabilities. Like students get lower cost for a lot of things. Ride share or car share programs. So somebody came up with the idea of having an app where people can ask for rides and just pay for gas. So if somebody's already going somewhere, somebody could pay $2 for their contribution to gas money and not have to pay an Uber, which is quite expensive. Bartering to exchange services for rides, like I'll walk your dog, or I'll babysit for you, or I'll, mow your lawn, or do some other, if you need help with something else. And then in exchange, I can get, you have a car and you can give me credit and you can give me rides around town if I need them. Driving cooperatives, people get together and pool resources around getting places in a car. Active transportation, so bike and scooter share rental programs. I know bike rental programs are much more common in urban areas, but there was a town, I believe, in Colorado that actually started one. A rural town started it. They had bike riding lessons in more than one language, and they taught people how to ride a bike, and then people could rent bikes to get around town. Making it easier to drive. So we know that in rural areas, getting around in a car is much easier. people with mental health conditions are way less likely to own a car because they're expensive. But there's also difficulty around navigating how to get a license or how to buy or sell a car, having money to do the maintenance. So car share programs are just making it easier for people to learn how to drive and be able to drive if they can even access a car. Resource solutions, so support for education, employment, loans and grants for school. They do exist, but providing people support for how to fill out those grants or where they are and telling people, this is available for school or new work or, how to get money to buy materials or clothing that you need to go to school or work. So finding a job is fine and dandy, but if you don't have the clothing to go to a job interview, that's another barrier. But helping people find the grants or the resources or the community centers or setting up a place where people who want to donate old clothes can donate it to like business professional clothes where they can donate it to like a specific population of people who are looking for work who might not be able to afford it. So I know those do exist in some areas. Supports to find employment or information about casual work to increase income. So part of this, and we have counseling about benefits and employment on here. So there's an idea that any work means you don't get your benefits anymore, but it's not, from my understanding, that simple. There is a threshold. And Rebecca, you probably know more about this than I do, but it is possible to do a little bit of casual work without losing your benefits. But I think people are so afraid of losing their benefits, they don't want to do any because they're not sure where that threshold is. And Rebecca, I don't know if you want to comment on that.
Yeah, there is a threshold, and for a lot of people, depending on what they're getting from other resources like disability. But for example, in Wyoming, the threshold for Medicaid benefits is $2,000 a month. So, a lot of people that are getting disability are sitting right at that $1,000 to $1,400 a month. And so it's casual work is going to be more doable in that than getting, say, a full-time or even half-time
Yeah.
job.
Yeah.
So yeah, and I think that that's a really good resource solution.
To letting people know, like, hey, I know you only have $500 or $600 leeway, but people don't know that. And we find a lot of people are like, oh, I can't work at all because I'll lose my benefits. But if people can get counseling, say, hey, no, you can earn up to $500 more, which over the year adds up and adds up even in a month. That if
Yeah.
they knew that, it might help a little bit.
I would say also federally vocational rehabilitation programs. There are programs for people with any type of disability to sort of ramp up to working full time that give like a grace period where you have this long that you can build employment experiences without using benefits for a
Yeah.
certain amount of time. And those are really good programs and not well known.
And so that's a big solution that people came up with, is somebody could educate us or work with us or support us to navigate these systems. It would help a lot. Another one was just, go ahead.
I just want to add in on these support for education and employment and support for basic needs. I'm going to add in a great example in a very small community in Wyoming, where the community themselves set up a thrift store, and it's just volunteer community members that run it. But every month the community had a meeting about what they were going to do with their money. And they were looking at kind of exactly what you're looking at here. And the first thing that they did is they bought a bus for transportation to Cheyenne, which is the nearest city that has all kinds of health resources that you don't have in a small town. But after that, because it was a thrift store, then they began providing clothing to people and providing all of these services through the thrift store. And it was so loosely run, like people would be like, well, I was going to go to the thrift store for help. They haven't been open in 5 days. I don't know what's, I mean, it was just a community resource, but they did a lot for people to deal with the kinds of barriers that are in rural places for people with disabilities or mental illness.
That's great. It's a great example. Yeah, it's possible. It just takes a little bit of effort. Support for basic needs. I know some people said that they wanted to have a place to sleep that didn't require login. It's not something I thought of, but that was something that people, more than one person, said was important. Just more supported housing or low income housing available. Decreasing
Question
costs. Yeah.
with the login, are you talking about shelters?
Yeah. they were wanting, people had made a comment of having shelters, having places to sleep, like shelters where they didn't have to log in. I don't know what there was about the login that they didn't want to do, but that was one of the ones that came up. So it might have been
Yeah. And a lot of rural areas have no shelters at all.
Yeah.
Like that's pretty rare, I think, in my part of the world.
Decreasing costs. So one of the great ideas people came up with is that if you buy a bunch of tickets at once, you can negotiate a discount. And so if agencies could get together and if there's X number of people who are interested in doing an activity, they could buy a bunch of tickets and negotiate a lower cost to make it affordable. Access to information about low cost or free events, because people often don't know about them. Restaurant discounts are a huge one. So in a lot of rural areas, like we were in a rural area and one of the restaurants had like Burger Tuesdays and you could get a burger for $5. If people are just thinking like, I can't afford to eat out ever, they might not even know because they would never go look at the menu. So if somebody who did eat out more or was aware of that could share that information, that would be helpful. And then the use of the library. So, I mean, libraries can be complicated because we know there is some stigma. Sometimes library workers are not always welcoming and embracing, but libraries are a great resource. There's free classes, books, movies, internet, computers. There's a lot of things in a library. And so people could help, like if there is a library in town, which I think most rural areas do have a library, that finding out what the library does or working with the library to have more programs or events for people to go to and having, hooking people up so they can go and understand, like, and have someone give them a tour of what's available. So just really trying to make that connection stronger because we've found in doing this work that libraries tend to be underutilized for some reason.
They do. And one of the best things about libraries is librarians. These are
Yeah.
people whose sole purpose is to help you and teach you how to do what you want to do and get the information that you need. Like they're in there waiting to show you how to access the internet. They're in there waiting to help you find this. So it's not just that the stuff is there, it's that the people are there. And that's a great resource.
Another area was healthcare. So people wanted broader health insurance coverage. So for eyewear, hearing aids. Again, these are policy things that are trickier. We're not going to change Medicaid or Medicare overnight. I always get the two mixed up, by the way. So this is my default of why my excuse. I'm Canadian. So I didn't grow up in the US healthcare system. And I, to this day, no matter how hard I try, I continuously mix up Medicare and Medicaid. So yeah.
I just
Go ahead.
You're right. This is a bigger issue, but we should always remember that when individuals self-advocate, they're helping the bigger issues of systems advocating. And just a couple of things related to this, that local voice, and in rural areas, people may not realize how much power they have with their local voice outside of their rural area. But for example, there are states still, and they tend to be rural states that have not done the Medicaid expansion. Which leaves great numbers of people without medical care. I think in Wyoming, self-directed care is available to people with mental health issues, but the screening is physical and it's done by a public health nurse. So advocating in that way can be helpful to a person, because the person doing a physical screening of someone, again, from that health model, is maybe not going to see the kinds of supports that somebody with mental health issues may need. So these resource solutions are true that they need to be dealt with in a systematic way, but that starts with your local public health nurse who's doing the evaluations, right? To start with our advocacy. So
Yeah, it's true. It seems like a big thing, but you got to start somewhere.
mm-hmm.
And then budget and financial counseling. So it's true, there's limited resources and people have low income, but not knowing how to budget or, budgeting is a big thing. And so having somebody teach you tricks of ways to save money or budgeting and looking at those types of things might actually help people make the limited income they have go a little bit farther. So solutions for personal factors that came up, support groups was one. So people said they wanted mental health groups that encourage storytelling. So people with lived experiences would share their stories to like, it's the idea if somebody else did it, I can do it too. And so having these stories of success to share some hope, and then also things that didn't go well, so people might be able to help you brainstorm barriers to be like, hey, I had a hard time doing X, and somebody can say, oh, I did too, and then I tried this and it worked. And just having this short story sharing area to kind of help each other overcome and give each other hope. And then they wanted general support groups for people who experience discrimination in general, not isolated to people with mental illnesses, which I think is a great idea. Because that again is a little bit more inclusive, because it's inviting everyone who's experienced discrimination to come along and share their experiences. Even though the discrimination might look different across marginalized groups, there is still a common thread. Because I think people in marginalized groups often tend to stick to their marginalized group. And the idea of this is, hey, spanning across groups, marginalized groups who all experience discrimination in and of itself is a source of inclusion.
This is so valuable. So Centers for Independent Living, for those of you who don't know, that's who April works with. And Centers for Independent Living, it's mandated they're in every state. Rural communities should be covered by one, even if it's not right there in the community. But they're based on a model of peer support. And although they're general to every disability, mental health disabilities are a large part of that. And the whole idea behind it is that nobody is going to understand the experience of somebody with any type of disability better than other people that have disabilities. And, this may be within the same disability, but very often it's cross disability. And particularly in rural communities, because the numbers of people are smaller, that when there's that interaction, for example, general support peer groups for people who experience discrimination, then they have a larger voice together, as well as that personal support piece that they have. And so so many of these things that we're talking about also very closely relate to the core services of independent living centers. I know there's a lot of different types of agencies that are represented in this audience, but in rural areas, SILs would be a good place to partner if they're looking at trying to find some of these resources for people.
That's a really good point. Peer support, to have someone go with you if you're nervous, was one. So going to do something for the first time might be scary. But if you had someone to go with you who's done it, it might be a lot easier to navigate that situation. I think, Rebecca, you probably wanted to add to this one.
I would also say with this, the idea of peer support is so important because people with mental illness are so isolated, and because of the stigma and they're staying at home, it's really easy to believe when you have a mental illness that you're the only one, right? Or that nobody else, like even if some other people have mental illness, you're thinking, well, that's just depression. Like nobody is going through what I'm going through. And so peer support becomes really important. But also sometimes people don't seek care, or they don't seek to socialize anywhere or go to school because they don't you don't want people to brush you off just because you have mental illness, but sometimes that can make you afraid to express yourself in your needs. And having somebody go with you, not to speak for you, right, but to help you deal with your nervousness and to kind of it takes a little bit of that out of the equation. If somebody there that is supportive of you, it's much less likely that other people are going to brush you off directly. So that peer support, to have people go with you, is really important. Even with medical professionals, I would say.
Yeah, I agree. Having accommodations, so people said having bigger spaces for drop-in centers so it's less crowded. Having access to noise canceling headphones, if things are loud and that's going to make you're going to get nervous and anxious because there's a lot of noise, a lot of stimuli coming at you. Having access to noise canceling headphones can fix it. Creating self and welcoming spaces, to going out in the community and talking to people about mental illness and trying to identify places that are warm and welcoming. Limiting the number of people at specific times or events. So working with a local business, or if there is a local museum or history place or sporting event or like rink where people are leisure or rec or a gym or a Y or something, that you work with them and say, hey, from 2 to 3 on Wednesdays, can we have a limited access so people who struggle with crowds can still use the facility? This happened during COVID. Target was one of the stores that from 7 to 8 in the morning, you couldn't go into Target unless you were over the age of 65, I believe, because that was a vulnerable population that was at higher risk for contracting COVID. So Targets basically said, we're going to limit who can come in. So there's less risk of exposure because there'd be far fewer people in the store at that time. So businesses did it during COVID where they limit, grocery stores did it all day long, where they only allowed 20 people in at a time. So it is possible. It's just a matter of working and talking to people to figure out how to do it. This one is related to personal factors, but it's specifically for the justice involved. So what we found fascinating is that even though being justice involved or being a felon didn't come up as a barrier, they had solutions for this. So it clearly is a big barrier, but people came up with some fascinating ideas for this one. So just educating service providers, landlords, and employers about what justice involved means, that there's a spectrum and it's not all the same level of, I think people are scared, like, oh, you have a felony or you went to jail, you must be a criminal and it's going to be too risky for me, and not understanding that how the criminal justice system works, and that maybe it was minor and somebody stole food because they were hungry, and it really is not always this thing to be terrified of. And then ensuring people have access to medication and treatment, transitioning so if they're leaving the criminal justice system, that there's proper transitioning in place so they're not just left without any medication or treatment when they come out. Financial incentives for people to provide housing and employment to people who have been justice involved, to kind of say, we know that you're worried, it's your business, it's your house, and you're concerned that it's a higher risk tenant or a higher risk employee. So we're going to give you a financial incentive to sort of compensate for your increased nervousness, to try to motivate people, to give people a chance. Increased reentry that focuses on broader criminal justice issues. So just understanding the system overall a bit more. Working with probation and parole officers so they can promote community inclusion and advocate for people to get jobs on their behalf. I think special housing for people who have been justice involved came up. And that was it. But I know, Rebecca, you had some things to add to this.
Yeah, this is a really big issue. And mental health concerns are a predictor of being involved in the justice system. According to the National Alliance on Mental Illness, 21% of adults experience mental illness. And for incarcerated people, the rates are much higher. The American Psychological Association reports that 64% of jail inmates, 54% of state prisoners, and 45% of federal prisoners have reported mental health concerns. And we start seeing this with youth. Youth with mental health concerns are much more likely to get involved in the criminal justice system. And some of the things, I know I feel like I'm Debbie Downer in this presentation,
No,
but
it's okay.
some of the issues even have to do with if people with mental health issues are involved, if they interact with law enforcement, they are more likely to be arrested and they are more likely to face bad outcomes. So like Wyoming, very limited, our whole state probably, I'm sure it has less people in the entire state than you have in your city. But in the last 10 years, we've had 2 people with mental illness who were unarmed that were shot and killed in an interaction with police. Because mental illness can look pretty threatening to people, I think. But anyway, we don't think about this. When we think about people coming out of the justice system or why they went into the justice system, mental health is not what we usually think about. But I would like to say, just related to this, there's a huge grant that's available, and it's called the Disability Innovation Fund, and it's aiming to try to fund systematic ways to help people who are transitioning. And there are a lot of different areas, but specifically, this has been a program that's been available to Voc Rehab to try to help people who have been involved in justice systems or who are isolated and disconnected to get back into jobs and back into housing and back into the resources that they need. And it used to be that only vocational rehabilitation centers could apply for this grant. The grant requires that vocational rehabilitation centers for independent living and educational places work together for support for youth on this, but it's available, it's opened up to any nonprofit agency. And April's applying for this grant to try to get some of this money in the hands of SILs that can do this. But so there are resources in our communities or outside that are available, particularly for this issue.
Thank you. That's really good information. I love that you have so many good personal, and like real life examples, Rebecca. We're running close to the end of time, so I'm just going to go through these quickly, but creating more welcoming environments. This is really about educating the public about mental illness, encouraging others to reach out, supporting people identify where those safe spaces are, but it's trying to teach people to essentially teach them about being more accepting, teaching the public, reducing labels, all of that kind of stuff. Advocacy in TV and film, I thought, was excellent because it's a big issue that TV and film misrepresent mental illnesses, people with mental illnesses all the time. At UCLA, I believe there was actually somebody who was in partnership working with the film industry in LA around creating better storylines for people with mental illnesses and other marginalized groups in film because it's such a big problem. And then increasing self-advocacy skills. Increasing natural support. So we actually have a project that is based on this first one. It's the idea of finding a bunch of people who might all have the same similar activity interests and then putting them together. So I like reading books. So to turn my solitary reading activity into a social thing, I joined a bunch of book clubs. Some people might like hiking. So even solitary activities can turn into social ones if you could find enough other people who like it. Using meetup apps, teaching people how to use Meetup and other social connection apps, having peer specialists help people connect to other natural supports. And when we're talking about natural supports, these are unpaid supports. And then supporting family members and teaching family members on how they can be more encouraging. So this is around dignity of risk. So people like, I don't want to let my loved one who has mental illness go out and do X because we're scared they're going to get taken advantage of, or they're going to get hurt, or someone's going to say something mean to them. But there's risk involved in lots of things in life. And there's also dignity around being exposed to risk. So that's how you learn. And it's not always bad. Not all bad experiences are bad. So you want to not put someone in the fire, but teaching people how to navigate that and understanding that people need to have independence to learn these things is also important. And then just
can I just step in on dignity of risk?
Yeah.
Dignity of risk is something we could educate everybody about, mental health professionals, doctors. But the idea of dignity of risk means that, you know what, when I left home, I got to fail a lot and everybody has the right to fail. They have the right to make a decision that turns out not to be in their best interest.
So another big one is access to information. So I'm just going to put these up to the sake of time, but this idea that people just don't know what community events are available. They don't know where the free and local events are. They don't know how to look for them. Like I was saying, they might not know that restaurants on Tuesday had a $5 burger in their town. And so helping people access the internet, showing them where to look. The best one, this was compiling a list. Sorry, so if agencies got together and compiled a list, then everyone could add to it and they could send it out once a week or once a month. So people knew what was coming up and it would be less effort for them to look for these things. And then greater discussions on dating, relationships, sexual and gender identity. They found that was a topic that people just didn't want to talk about. So that's the end of it. But one of the reasons why we did this webinar was because we are offering support to, we want to offer support to people if they're interested in learning how to implement some of these strategies. So we are looking for about 5 rural communities that we can work with to provide additional support on promoting community inclusion and participation for people with mental health conditions. So it has to be the population you serve has to be people with mental illnesses, and that's based on our funding source. So that is a grant funding related issue in rural areas. So we will accept requests from a state, so state office of mental health or association of providers in the state, county or region, regional office of mental health, or a mental health agency in a rural area to offer these supports. What we're gonna do is if somebody emails, it's my email, so you can email me if you're interested to get more information. But we have a little survey that we'll probably ask you to send out to the people that would be involved in the training, and we're basically gonna assess whether or not people think this is important, if they think they have the resources to do it, whether or not they, think that they're going to be supported in doing this, because we don't want this to be forced on people. So we don't want it to be, they don't like it's obligated that they are obliged to do this. We want to offer this support to people or providers or policymakers who really, really, really think this is important and are really motivated to learn, because we can't do it with everyone. So we're going to take the easy route and start with the people who really are keen and motivated to do this. So that's my email. I can also put it in the chat. And then I think Rebecca just had a couple other things to say about their services, and then we're open for questions.
I saw a few people put in the chat some questions about services from Centers for Independent Living, about peer supports. And I saw somebody ask if they do, for example, like art groups or that sort of thing. Centers for Independent Living, they all provide information and referral, peer support, advocacy, skills training, and a variety of other programs to people with disabilities. And that includes people with mental illness. And so, yes, there are some art groups, but local CILs will have different offerings. But I would encourage, if you are a provider in any other way, or if you are interested in finding out about these resources, look for your local CIL. And it may not be in your town, but it serves your town. There are CILs. Also, through April and the ILNet, we have a couple of programs that I think might particularly be interest if somebody has a CIL, they're working in a CIL, and they want to expand on any of these programs. Any of the things that we've talked about, transportation, housing, CILs are doing that somewhere. And so we have two programs that I think would be helpful if you are a Center for Independent Living. The first is the peer-to-peer mentoring program, and this basically is where we connect CILs with this, a CIL that wants to develop this type of programming or this type of strength. We hook them up with somebody that has that, so they can learn best from other people who are doing these kinds of activities. And then we also have a Rural Core conversation series that happens once or twice a month, where different CILs are talking about the needs of their consumers and how they're providing those. So those are a couple of peer resources. If you're interested in CILs at all, or you're interested in those programs, you can contact me, and my email was there.